Hello friends, today we'll see the features and attachments of clavicle. Clavicle is a modified long bone. It has two ends, the sternal end and the acromial end. The sternal end is forming the sternoclavicular joint, which is a saddle synovial joint, while the acromial end is forming the plain synovial joint. So it has two ends, the sternal end and acromial end, and a shaft. So we can see that the two-third medial two-third is convex anteriorly, while the lateral one-third is convex posteriorly. We can see on the inferior surface of the clavicle the trapezoid, ridge, the conoid tubercle, the groove for subclavius muscle, and the rough impression for the costoclavicular joint. So these are certain features. We can see the attachments. We'll have pectoralis major on the anterior border of the medial half, while the sternocleidomastoid is present in middle. It is the sternocleidomastoid. We can see anteriorly only in the lateral one-third the attachment of the deltoid muscle, while on the posterior border of the lateral one-third we can see the trapezoid muscle. If we see on the inferior side of the clavicle, we can see the attachments of the trapezoid and the conoid part of the coracoclavicular ligament and the attachment of the costoclavicular ligament. And in the groove for the subclavius, we can have subclavius muscle, while the pectoralis major is also coming on the inferior side and deltoid also coming on the inferior side. These were the features and attachments of the clavicle. Now on the clinical aspect of the clavicle, we'll say that the middle one third, that is middle one third of the clavicle is vulnerable for fractures. When it is fractured, the medial part is displaced superiorly. Medial part is displaced superiorly due to the pull by the sternocleidomastoid, while the lateral part is displaced inferiorly due to the pull by the shoulder joint. Thank you.